Hello, welcome to people who've just joined. I'm Lucy and I'll be your host for the night. So I'll just keep on admitting people to the meeting for the next 5 minutes while we kind of wait for everyone to join. We'll be doing an interview style session with Dr. Liew today. So I'll be asking some questions I've got prepared, but also I would very much appreciate if you can also feel free to turn on your videos and your mics and jump in to ask your questions over the microphone, or you can type them in your chat box if you have any questions. So, and then we can kind of, I'll be looking at the chat box as we speak. So we can go through them as we go if it's relevant, or we can kind of save them at the end and go through them all at once. So for the people who just joined, like I said, I'll just wait for a few more minutes for people to join. I'm Lucy. I'm going to be hosting the session tonight, and feel free to ask questions along the way or type in the little chat box in Zoom. And we'll just wait while we admit more people. So for people who've just joined, a bit about me. I'm a resident at the moment at Royal North Shore Hospital in Sydney. And I will be running a few of these student series. I don't know if any of you actually attended a previous session, but we'll have doctors and allied health and all kind of other healthcare professionals join us and give us a bit of an idea of what they do on the daily. And yeah, this is our surgery session for the season. So we'll just wait a little longer for anyone who might be wanting to join, and then we'll get started with Dr. Liew. I guess, does anyone want to maybe type in the chat box, or you can speak as well if you'd like. Just let me know kind of where you're from, what stage you're at. Like, are you from a university or have you started work as a junior doctor? You can type in the chat box, that'd be great. So I can kind of get a sense of where everyone's from. So we've got Sadia, welcome from UNSW in third year. Come on, guys, don't be shy. University of New England, another UNSW. Another UNSW. Oh, great. I also went to UNSW. So probably saw me posting on the notice board a lot.
Hey, Lucy.
Hello, welcome. Thank you for joining us. All right.
Thank you very much for having me.
It's an absolute honor. So we'll get started into our session then, if that's all right with you.
Sure.
I guess before we start, if it's okay, I'll just quickly introduce AMSC as an organization, what we're doing with the student series. So AMSC, as you can see in my background perhaps, is Australasian Medical Services Coalition, and we're a platform which aims to connect all the healthcare professionals, not just doctor to doctor, which is a lot of the healthcare organizations, but also with allied health professionals, nursing staff, and even practice managers, because they all play an important role in our healthcare system. For students, we've got free membership for you guys until you graduate, and we aim to run a lot of these kind of education sessions to really support and upskill students. So if you have any questions, feel free to ask me or check out our website, which I'll put up at the end as well. So, and now to Dr. Liew. Thank you again for joining us. So I'm going to introduce our speaker tonight. Dr. Liew is a plastic and reconstructive surgeon. And in addition to his running of his sheep clinic in Darlinghurst, he's also a speaker at international lecture circuits. He runs hands-on injectables trainings and has started his own conference. Actually, just last weekend, he's successfully run a lower face show and from what I understand, for mainly non-surgical procedures. So welcome, Dr. Liew. Thank you for speaking to us today. I'm sure you'll have lots of great experience to share.
Thank you very much for having me. I think I'm going to start. I think for a lot of your viewers, most of them are junior doctors and medical students. A lot of them are pretty confused and intrigued on what do plastic surgeons do. Plastic surgery is a subspecialty of surgery. In fact, you can think of a plastic surgeon as the last bastion of the general surgery by tradition. Plastic surgeons deal with every part of the face, from brain, face to toes to anything. That's by tradition. And then we subspecialize into things within plastic surgery. You can be a general plastic surgeon. You can subspecialize in cosmetic surgery. You can subspecialize in pediatric plastic surgery, your cleft lip, cleft palate, deformed face. As an entity, we specialize in repairing. We specialize in solving problems because the word plastics, it's not your plastics. Plastics rise from a Greek word called plastiko, which means to mold, to shape, to fill in everything. So most in the hospital setting, in a big teaching hospital setting, we get called in if other specialties, such as your physicians who have a wound they can't heal, your cardiac surgeon do a heart transplant, they can't close the heart, and your pediatric plastic surgeon who have a conjoined twins, they can't close it because the brain's exposed. We are the specialty who close it for them. Because after all, if you can close your heart, eventually you die. Right. You can close your brain, your spinal cord, you die. Or, for instance, in tumor surgery, I know you are in obstetrics, your residence in ONG at the moment. If you are in oncology, if some patient have some sort of genital resection for cancer, our job is to reconstruct them so that it remains functioning as a urogenital organ. So our job is huge. That's why our training is quite vast. Plastic surgery is probably, I should say, plastic and reconstructive surgery is probably the most sought after subspecialty at the moment. And you can tell because the number of trainees per number of positions. On average, because there's a supply and demand things, and you get the cream of the crop always want to get into. As a result, we're seeing a bunch of extremely overqualified trainee wanting to get in. So not to discourage you, on average, it takes about 10 to 12 years after university before you get qualified. And on average, it takes about PGY 6 or 7 before you get selected into a specialist training scheme for plastic surgery. So that's how in demand these specialties. I guess, it's always trendy. I'm a plastic surgeon. It does have this sort of very glamorous and flamboyant sort of connotation to come with it because of the Hollywood and things like that. And, for me, I'm someone who have done all those training at the hospital, and in the last 15 years, my specialty is basically in the field of aesthetic. And the area that I focus most is in the areas of aesthetic plastic surgery of the face and breast, with also a component in the non-surgery. So aesthetic is my game, and that's what I do on a daily basis. There you have, in a nutshell, that's what I do.
Great, great. Thank you for the overview. So I guess a bit more about kind of how you got here, because obviously, as you said, it's a very long road. And I think I've heard from co-workers that you've also done some training overseas. So can you tell us a little bit about that process, I guess, from when you've graduated medical school until getting here? What has the process been like?
Well, I will take you a little bit of the journey just prior to that. I never want to be a doctor. It's really not what I'm interested in. I think since I was little, I was attracted to aesthetics in a slightly different way. I love photography. I want to be a fashion photographer. That's what interests me. I love colors. I love fashion. I love the shape of human faces. So that's what attracted me. I still own a lot more textbooks on photographies, a lot more textbook on makeups, on colors and all this stuff. That's something's always attracted me. But I guess sort of I grew up in a tiny little village in Malaysia. I was here, my dad's over there, so I rang to my dad, said I want to be a photographer, you know, a very typical humble conservative Asian family. That's very cliche. His response to me was, it's a hobby, son. So that was my dream being shattered. So at the early age, then what do you do? Well, you know, didn't really know what else to do. So I said, well, I'll become a doctor. Didn't really know what it meant. And then, you know, go through university. Of course, if I become a doctor, I should be a surgeon because it is, wow, a surgeon. And partly because I'm very technical. You know, I'm not one of those who can sit still. Something to do is what interests me. So I got into general surgery pretty fast. PGY3, I've already got selected as a specialist training. But really I didn't particularly like it. I can do a lot of the technical work. I can take out the appendix, take out breast, laparoscopic work. Those are something that interests me. But the actual work of general surgery and doing colorectal surgery, cancer, things like that, really did not interest me. My heart wasn't in it. So it created a dilemma. Because I remember I was in my last year. At that stage, the training was 4 years training. I was in my specialist 3 years. So by that stage, I was PGY 6.
Yeah.
I was about to sit for my fellowship exam, qualify as a general surgeon, and create a bit of an issue because that won't become real. You have to decide, well, that's going to define your career. It just so happens serendipitously, someone in the plastic surgery, a trainee, fell pregnant. She couldn't cope, morning sickness. So the superintendent called me and asked me whether I would consider stepping in for 3 months as part of my advanced surgical training, of course. You know, that was the turning moment.
Yeah.
First day, there was this young man from a factory accident. I remember vividly that hand got caught in a conveyor belt, lost the entire skin and muscle. You can see the median nerve and the brachial artery exposed. So it's a big hole with the bone exposed. And then it's something very foreign to me. How do you close it up? Because you lost so much tissue. And you can't just let your major nerve hang in there. So the surgeon at that stage basically stuck the arm through the abdomen, raised up the skin and fat just to hook it up. And that was, I mean, we don't do that anymore. We're talking about 30 years ago. Now that was the way to do it then. And the man was strapped to the abdomen for about 3 weeks. And then we basically detached the skin, and now the arms, the tummy skin become the skin in the forearm. That was amazing. And of course, we have various individuals with a big hole in the nose, and we rearrange the tissue to close it up. Not only get rid of cancer, but it aesthetically looks good. Now that attracts me because suddenly everything is visual. It fits into what I love from my childhood. So that's how, it's a no-brainer, because I knew at that stage it's something that I wanted to do.
Yeah.
So that's how it started. So I finished my training. I went to New York to subspecialize in face and breast. And then I came back, and here I am.
And here you are. Here you are. Wow,
Mm.
what a story! That switch from general surgery to plastics, and
Yeah.
was it an easy choice for you at that moment? After those 3 months, you were like, "Yep, that's it."
Oh yeah, that was an easy moment, but then the hard question is, how do you get selected, right? Now the pathway then is very different compared to pathway for you guys who are interested, because I was very senior then from a general surgical perspective.
Yeah.
And the general surgeon does not like you to sort of jump ship, because they've invested so much time and effort. And I have a few very senior surgeons who supported my passion. So with their kind of blessings, and I wrote a letter to the college to express to them my intention. And I was lucky enough, I guess, to be selected the next year into the plastic surgery scheme. In those days, there's not a lot of jobs, and sometimes in the entire state of New South Wales, there could be 2 jobs. And when you have 50 trainees going for it. So I guess it's, the right time, the right sort of credential for me to get in. So I'm fairly lucky. I got in very quickly and managed to pass the exam in one hit and got through. So basically, my journey took me about 8.5 years from university to get in.
Right. Finishing your training.
Yeah.
And I guess, do these surgical programs usually have a component where you go to overseas to do a fellowship, or is that a choice?
It is not compulsory. It is by choice. Most of us at that stage wanting to, because you want to have a bearing of where you are in the global world.
Yeah.
Right. Now we know that in terms of plastic surgery, in terms of various components, we are very, very, very up there. Don't forget, the first published microsurgery transfer of tissue from the hip to create a jaw was performed in Australia in 1973. So we are the pioneer. In those days, there are a lot of overseas pioneers, the big doyen. They actually came to Australia to learn. So wanting a fellowship by the Australian trainee overseas is pretty easy. We are in high demand. So through that and through my boss, I was lucky now to get to, a very prestigious institute in New York, specializing in cancer surgery. So my aim at that stage was focusing, I guess, 2 things, because I want to learn a way of getting the fibular bone and reconstruct and mold it into a 3-dimensional jawbone for trauma, for cancer surgery, doing microsurgery to reconstruct them. That was my specialty when I came back. And also through there, I want to link that with my facial aesthetic work and my breast work. So that's what I concentrate on, right? And then, of course, when I came back in 2001, after September 11, I started my junior consultancy at St. Vincent's Public Hospital, and through there I work at St. Vincent's Clinic and St. Vincent's Private Hospital, and I'm still working at the St. Vincent's Private Hospital.
Right, yeah. And can you give us a little bit of an overview of, now kind of what's your day-to-day, or I guess week-to-week routine of, where do you work, what kind of cases you see?
Okay, yeah. So I 95 to 96% of my work are pure elective aesthetic cosmetic work, whether it's surgery or non-surgery. I group them into one. I still retain the 4% of the smaller reconstructive work for instance, patient with cancer to half of the nose, to the tip of the nose, and those sort of things. Because for me, that's the beauty of plastic surgery. And I use the word plastic surgery loosely because plastic surgery, cosmetic surgery is part of plastic surgery, right? So if someone with half of the nose removed from skin cancer, yes, they're concerned about skin cancer for 1 minute. After the cancer's been removed, what's left behind is their face for the rest of their life. Okay, skin cancer is easily cured. It is the resulting defect that will remind them of their skin cancer. So our job is to reconstruct that defect so that it functions as a nose, but more importantly, it looks so damn good. So hopefully people can't even see it.
Yeah.
Because we've all been through a situation where if something from the face or the body is slightly unusual, our eyes drawn to it. Okay, think of the last time you were in the public transport where you couldn't stop yourself from staring something. Right?
Yeah.
So if you can stare at something, imagine that particular person. They know someone is staring at them, and then what do? They want to hide. So that's why, I've always said to my trainee that we don't save life anymore. I don't save life anymore. I like to think that what I do is important in affecting or improving people's quality of life.
Yeah.
That is very true. I think, if you are very young, you may not be aware of it. Once you pass an age, once you know a relative or someone with that, you understand the importance of it. Particularly the society is changing, the generation X now, the generation Y and all this stuff, because physical appearance is very important nowadays. Think of the social media, think of the number of filters people use. So that's why it is extremely important of what we do. So that's a small component. From a day-to-day basis, one day a fortnight, I would see those skin cancer, those moles, those sort of bad scarring from whatever, dog bites, accidents, pimples. The rest of my days were either spent operating. I operating between 2.5 days a week to 3 days a week. And then one of the day I would just do a full day consulting for my aesthetic patient, either facelift, eyelids, breasts, making bigger, making smaller, lifting them, making more symmetrical. And one day a week, I dedicate myself to the non-surgical world, your fillers, your Botox and all that stuff. So that's basically my week. I wear a different hat on different day. Whether one day is a technician, one day is a clinician, one day is just my play day when I do non-surgery. That's my play day.
That's your play day. Which one's your favorite
Well, it
day?
is a play day. My favorite day, there are two components. I like the day when I inject because it's relatively stress-free.
Yeah.
As I see that as a very, very stress-free because the patient come in, they're talking to you, you're telling them their life story, their concern, and you are creating something for them. And it depends on what we do, they can see the changes straight away, right? So they may have a dark shadow, they may have a hollow cheek, they're creating, casting unsightly shadows, but suddenly within 20 minutes, you can actually get rid of that. So they walk out looking fairly happy and upbeat and walk away. Right. I'll give you an idea for you guys listening who've been very quiet. Think about the last time, male or female, you went to your hairdresser, you had that fantastic haircut or colors or whatever, you do hair extension or eyelashes or anything. And when you look at that reflection from the mirror and it looks so good, your endorphins start flowing, your mood start going. Suddenly what happened when you get home, you're more motivated, you whistle, you sing, your mood is much better. You become friendlier to your friends, your roommate, your family members, your partners, and even your work or patient. So do not underestimate your sense of well-being. And that's what those things that what we do for them.
Yeah, and that confidence, I guess, for people,
Yeah.
as you said, like the kind of appearance is so much of our kind of daily social interactions with other people that it makes a big difference. Yeah. And I guess out of all of these, would you say those are your favorite procedures, or do you have like a pet favorite procedure to do?
Yeah, the facelift and the eyelid surgery will be something that I like it a lot, because not only is technically requirement, is the variety of things you can do to the patient, the shape of it. What are you going to do with it? Do you make it more hollow, make it fuller, change the shape, make it bigger, make it smaller, those sort of things. So that's something that is very, very appealing to me.
Yeah, fair enough. And I guess, these sound like some really, fun and also beneficial for kind of patients' wellbeing procedures. But on the flip side, are there any kind of not so great parts of your job that you deal with?
Of course. In my line of work in the cosmetic surgery, we do attract a lot of patients whom may be wanting to come and see you and wanting something done for the wrong reasons. And that's the bit that is for us to be, as a true professional plastic surgeon, to be extremely aware of, because to manage the expectation and try to figure out why is it they want certain things. You do also need to deal with a bunch of individuals who could have BDD, body dysmorphia disorder. So sometimes that could be extremely difficult to pick until you operate it or you do something for it. So those are the not so fun bit, dealing with the expectation, because you can execute your surgery or your injectable perfectly. They may have a very distorted view of what they look like. And as a result, become not very happy with what you're doing.
Yeah.
So that's the not such a fun bit.
Yeah.
But in general, 95% of my patients, I would say, are very, very satisfied to what they have. And 5% is the one that we need to manage their expectation a little bit and possibly not do any invasive surgery on them.
Yeah. So it's that kind of clinical judgment as well as the technical skill that you have. Yeah.
Correct.
I think we've got a question from the crowd. So Sadie has messaged saying she has a question. If you want to, ask away.
Hey, Sadie.
Hi, it's Sadia. So I just have a quick question, which kind of relates to what you were saying before as well. So I guess it's becoming a lot more relevant now with younger people using a lot of social media, and with the advent of Instagram and influencers always posting really photoshopped photos. How do you deal with really young patients or people who want to come in for plastic surgery who present photos of what they want to look like that are obviously really photoshopped, or if they come in asking for, like a nose that looks exactly like this model when it's not really achievable? Like, do you think that's a difficult conversation that you've had to have with a lot of patients recently?
It is not a difficult conversation. It is not a difficult conversation for me at this stage of my professional life. I think that's the confidence bit, because you have been through all these before. You realize that some of the patients that they will not satisfied with whatever you do. So the first thing you do is, I cannot meet your expectation. You may have to see somebody else. So I've always maintained, if you think what the patient wants is not exactly share with my personal aesthetics view, I will not do it. Now, I put it bluntly because of experience. I'll give you a very typical example. Let's go to breast augmentation surgery. I think in the first 5 years of my career, you would have patient coming in wanting certain size and things like that. And I'm guilty as that. I would say, of course, I'll do it for you because you have your first patient. Oh my God, you felt they came to see me. You know, of course, I'm going to do it.
Mhm.
So after 5 years of doing it, and I've decided one night to look at all my results. So I sat there in my office, play it, okay? Things that I like, I wrote down, click. At the end of that night, it's a very humble experience. I would have gone through about 300 to 400 of breasts that I've done in the 5 years. I thought I liked probably just about 60% of my work, okay? So for that stage, I make a conscious decision that I will only do things that will fit in what I feel aesthetically good for the patient and not to the extreme of what they want. So that's how I guess you become a lot more grounded and things like that. It is quite a gray area, cosmetic, because it's a very subjective thing, okay? I'm sure you guys have seen women walking in your circle of life with the biggest lip or biggest cheek and those sort of things, right? Those are not aesthetics. Those are very distorted look, because aesthetics means to make it better. And it is my quest, I feel, that I reach a certain, I guess, professionalism, certain professional standing within my community, that I do quite vocal when I say this sort of thing, so that whether it's in my conference or in any global conference, I would critique that as being what we do to certain patient is wrong. We shouldn't be doing it, right? Because if you keep doing it, you will convince yourself that is the right thing to do. If a patient coming with such a big lip, yes, of course, you can add another syringe in there because it's good for business, but it's not one of the reasons we become a professional doctors to start with. The first is to know. That's our philosophy. So that is require dedication from our own individual self and our confidence, I guess.
Mm.
Okay. The other part of the spectrum could be, well, it's a service industry. They come in, they want this, I give them. Okay. A lot of my colleagues do that, but that's not how I feel is the right thing to do.
Yeah, that was really.
I think most of us want to do the right thing.
Yeah. I just have one more really quick question, because you mentioned that you spend around like a day a week doing injectables. So there's a lot of research now about how injectables, they don't actually last the 6 to 12 months like they're advertised, but they just migrate in your face. Do you feel with like patients who have been coming to you for a really long time, who have consistently been getting fillers, that you've noticed that their face overall has become more round?
Yeah, I like to think that that is a very, very small numbers in my clinic, because I have a philosophy in my clinic. Even though they ask for more, we can say no. Okay, so not sure how familiar you are in this industry. Basically, there is not a lot of requirement for you to be an injector. If you're a medical doctor, from when you pass, I'm not sure whether you can do it as an intern, but I'm sure that by the time you get your provider number, you can actually qualify and go out there and say, I want to be an injector. Okay. Equally, there's no stopping you to go out there to call yourself a cosmetic surgeon and start operating. Okay. So let's put it that way. It's quite scary, isn't it? It's very, very scary if you think about it. Equally, there's no stopping any nurses who graduated to become an injector.
Mm.
Okay, so if you don't have a solid training, a solid understanding, then you could inject. So I'm going to refute what you have just said, that the fillers does not last 6 months. Fillers in general last a lot longer than 6 months. Some fillers we know last for 18 months. If it is done well, if it is done in the right deep compartment, it should move from here to here as a routine. However, if you pump up this much in, of course, when you slip on it, it's going to spread. So for every patient that every person that you've come across having that big lip and things like that, I can tell you it could be 10 that you don't know they have something done, if it is done very well. Okay, that's why I love it, because it complements what I do. Because if you do injectable very, very well, you can maintain someone's look so well. There's no reason why a patient need to come and see me every month. There's simply no reason for them to come and see me every month. Okay, once I have seen a patient that I have treated the patient with fillers, let's say, give me someone who's 40 years old. Okay, once let's say I've done 2 or 3 sessions to treat whatever they need for their face, there's no reason for them to come and see me every 3 months for fillers. I would normally say, come and see me in 6 months' time. You may need something, you may not. They may come and see me every 4 or 5 months for a little bit of Botox injection. But fillers, no. Sometimes I say, see me in 12 months for me to have a look at you. Okay. Equally, there are a lot of clinics want you to go back every 2 months to top up the lip. That's when the lips become so big. There's simply no reason for it. That's for commercial reasons.
Mm.
Hope it answered your question, Sadia.
Yeah, thank you so much.
Okay.
Thanks, Sadia. And I think we also had a question from Lucy in the crowd. Lucy, what?
Mm-hmm.
Yeah, hi.
Let us see you, Lucy. We can't see you.
Hello.
Do you want to
Lucy.
turn on your video?
Yeah, we can see her now.
Great. I was just wondering, what's your opinion on like the qualifications needed for injections? Like, do you think it's something nurses should be doing with the right extra training, or do you think it's really?
Yeah. I think, okay, I will give you my honest opinion. I think I have seen the best injector being a nurse. I've seen the best injector being a general practitioner. I have seen the best injector being a dermatologist and plastic surgeon. Equally, I've seen the worst injector being any one of those. So I think the fact that you are a plastic surgeon, the fact that you are a dermatologist, the fact that you are a cosmetic physician does not guarantee you being the best injector. The best injector are those who are able to sit down and learn about each and every technical aspect of the things, understanding the face as a whole, but also good with their eyes, the aesthetic skills. There is a saying that you can teach someone every single thing, and I can teach anyone to be a reasonable injector, but for someone to be the next level injector, they need to have that aesthetic eyes. Okay, and I say that because there are a lot of artists there who can actually paint and draw. Okay, as a technical skill, they can. Why is it that there is only 1% who are that level? It's because of their aesthetic eyes to be able to create. So that's the difference. I hope it answers your question, Lucy.
Yeah, thank you.
Okay.
Yeah, thank you. I guess it really is kind of like an art as well as the medicine part as well. Yeah.
I think the first thing is you need to be competent from the medical side of the things, the human anatomy, physiology, understanding of what the tool that you're using. The next part is trying to refine your aesthetic eyes, because that you can learn that and refine that throughout the years. And
Mm.
my advice to all the injectors out there is look at the makeup artists, how they actually transform faces. And that's still today is what I do. As I said, I have a lot more books on those makeups and how they sculpt, how they, transform faces with makeup.
Yeah. I guess it's also something kind of you learn and build up throughout the years. It's a different type of training in essence.
Yeah.
That you've done kind of separate to the medical part.
Yeah.
And kind of speaking of kind of injectors and training them, can you tell us also a little bit about kind of the stuff you do outside of your your clinic work, the I guess the unconventional parts of the job?
Okay. Well, I'm a bit of I get bored easily. I get bored easily. I'm a dreamer. I'm also a rebel. I hate status quo. I mean, how many times have you heard in whatever branch of medicine, conventionally, this is how we do things? I'll give you an example. Please don't do this if you are a trainee now. Please, I repeat. So if you're a trainee, if you're general surgical trainee, there are certain ways in the old days when we do an open appendixectomy. All right, you find the appendix stump, you remove the appendix, you have to cut it out and bury the stump with a purse string. And that's a conventional thing. And I remember asking my boss, why do we have to do that? And the response has always been, well, this has always been proven, time tested and proven technique, because I never fully understood why do we have to, because it's cumbersome, it's wasting time. So when you are after hours, when you are on call, and because you are senior, you get to do the operation on your own. I never used to do that technique. I actually go and do a similar technique, bear it in a different way. And after 4 years, I realized it does not make any difference. Okay. And now open appendix is not common anymore. It tends to be laparoscopically. They hardly put a purse string anymore. So that proved the point that unless you question something, you always do the same thing. So because of that, I started my own conference. I started my own conference because medical conference tend to be pretty boring. You can predict what's going to happen. It's a 3-day conference. There'll be lots of lectures. And even as a medical student or resident, most of the medical lectures at university are pretty boring. Okay, are pretty dry. Yeah, and most of the time you fall asleep. And I remember there's only one lecture that was very, very good. And some of you, of my batch who went to Sydney University, there was one biochemistry lecture. When that professor gave that lecture in year 3, it was a 5-year course, that auditorium always jam-packed. And because he was giving this talk on, what is it? He's giving this talk on the, I can't think of the name, the crisis, is hereditary, and the royal family, the British royal family's got it. Rather than talking about the disease, he started tracing the entire British royal family and how there's incest in between, and telling your story how that hereditary diseases get transmitted. And that is the way we should think of things, is to create a way of telling a story, because nowadays we have this thing called the phone that distracts us. I'm sure some of you who are blocked now are on the phone because what I'm saying to you is boring. You'll be checking everything else, or even maybe Google me, because distraction. Okay, we're all in the moment. So that's a reason why when I create an educational platform, whether it's online or whether it is real life, I want to have some entertainment value in there, so that the audience does not want to miss out, FOMO, because they don't know what's coming out next. So that's the essence of it. And we're lucky in the fact that my first face-to-face conference called Aesthetics has been extremely successful. We sold out 2 months beforehand.
Oh,
And
wow.
the last 3 virtual has been extremely successful because, you know, I call it the edutainment, education and entertainment. You know, there is such a word. Initially, when I thought of it, I thought, my God, as a where English is my second language, you know, I thought of this when I Google, it's already been taken. So my advice to you guys is always start learning the basic, the convention, because that's where you need to fully understand. Once you understand a topic, once you have the foundation, that's when you can start breaking the rules. Right? So when you can start breaking the rules, I'll give you an example. There's always a little bit of standard of how we look at faces and all this stuff, and how this should be this ratio and things like that. When you see a supermodel, suddenly you realize they don't fit in, and that's why they're supermodel. Right? Otherwise, you just fit into a normal model and not the supermodel, because supermodel have something that is beyond the convention. And if you want to be up there, not just good, you need to have that sort of edginess to it to be able to think outside of the box, to think, why do I have to, if I keep doing the same thing, what everybody do, there's nothing special about you. You just be another one.
Yeah.
I'm not suggesting you want to do something different for the sake of doing different. You need to have a reason why to do that. And just break away from the usual mold, break away from the status quo. Because if you keep status quo, there will not be progress.
Yeah.
Right? Don't get me wrong. It doesn't mean that every single thing that I do has been a success. There's a lot of failure in between too, because that's what taking a risk means. You need to be able to take that risk. And then eventually, after a few failure, and hopefully you learn from it so well that the next few one is going to be a hit.
Yeah, absolutely. It's about getting the basics right and then kind of building on that. And I guess, putting thought into everything you do and not just following the rules for the sake of it either. Yeah, thank you. And a bit more questions I've been messaged about is that, what advice would you give to junior medical students or junior doctors about someone who's interested in plastic surgery? Like, what can you do to get more of an exposure to it, and also kind of, be in the best place to prepare for training?
Okay, right. First of all, if you have not seen or involved in a term of plastic surgery, make sure you do it. Make sure you request it, because it's very important, because plastic surgery is not just your Hollywood glamour. Okay, I've mentioned that before, because it's far from it. But if you truly want to be involved in aesthetic work, I am biased. I think it's always good to have a basic foundation as a qualified surgeon, because some of you may know you don't have to do what I do. You don't even have to need any formal qualification to call yourself a cosmetic surgeon. You don't need to go through that hard slog, right? I would never be able to do that, because before I open someone's face, I need to know, I need to be confident if I got into the wrong place, I need to be able to get out of it, right?
Yeah.
If that patient have a major complication, I want to know that I'll be able to look after this person. Why? Because of my training of a plastic surgeon, I deal with patients where half the face has been removed. I have seen the guts of it. I know how to put it back together. Okay. Rather than, oh, oop, I didn't know that's going to happen, send that to the emergency. That's, once again, you can do that. There's absolutely nothing wrong with that. If you feel that that is how you're going to roll, that's fine. I think majority of us want to actually do the right thing. So why not be going through the training? It is a hard slog. There's no question about it. But in the process, it makes your thinking a lot more mature. It makes you a more confident way, and to be a much better problem solver, because you have gone through that solid training. You've seen a lot of things, which is also like, well, what happened to this face or body, or because you can see how the person is going to heal up.
Yeah.
So that will be the right thing to do. Of course, some of you may not have that ability, and some of you may want to subspecialize in a non-surgical component of the aesthetic surgery. And this is why this particular society of yours important, because there's no reason why through that society you guys can contact some of us within the member and for you to come and do our clinic to have a look. And that certainly happened, and we do have visitors come to our office almost on a weekly, second weekly basis. Before COVID, you know, we have people come and visit Shape Clinic from overseas, you know, regular basis.
Yeah.
So that's one of the reasons you want to sort of join certain society, to actually create that network of things so that you can get asked those sort of questions, I guess.
Yeah, absolutely.
Because we never have that. We never had that when I was in training.
Right. So it would have been hard to kind of know who's out there. So would you say that?
Correct. For me, I just was. I mean,
Sorry.
for me, I just sort of, I guess I fell into it, you know, by chance, serendipitously.
Yeah. And I guess, would you say that most consultants wouldn't mind kind of if someone asked them, hey, I'm really interested, can I please sit in with your clinic?
Yeah. I mean, what's the worst thing they can say? No.
Yeah.
Ask somebody else. Yeah.
Exactly. Yeah, I do think that as a med student, I remember, it just felt like consultants were so far away from my level of training that it seemed like a very difficult task. But, like after working, I do think most people are very approachable, especially for people who are interested in learning about their specialty. Most people are quite actually very, very helpful. And then I guess, are there specific things that they can do outside of their medical school rotations to learn more about plastic surgery, or to, I guess, not just get more exposure, but become I don't know, when thinking about applying for training, what other things do they look for aside from just your studies?
Well, the training is very different. First of all, they need to look at what terms, they're quite specific requirement.
Yeah.
They need to be selected. Then when you choose your term in your RMO 2 and 3, then you may start to wanting to get rotation through the plastic surgery term first. And then through there, you get what we call an unaccredited training position, and there are certainly available in various teaching hospital, and get involved in those sort of things. Now, then the next part is people tend to bulk up their CV by doing some research. A lot of them become master of surgery in certain areas, such as anatomy and all this stuff. Not many people do PhD as yet. There's 1 or 2 people do PhD before they get selected, right? As I said, on average, it's a PGY 6, those sort of things. Lately, I have a lot of, I guess, some patients of mine who are RMOs. I would particularly, some people have to think of the work-life balance, particularly if they want to start the family and all this stuff. Then I would say to them, if aesthetic is your gig, then getting involved in the non-surgical side is quite interesting. It's such a big, expanding field now that it is itself become a subspecialty. There's no reason to do that, because if you're good at it, if you enjoy it, and you have a family, there's no reason why you can't do it as a part-time and still be able to sustain your lifestyle. So it's something to think about, right? Now, if you're interested in that, that is not in your hospital environment, that is outside of hospital. Once again, I'm sure there'll be enough, cosmetic doctors out within this society, the AMSC, for you guys to get in touch with, and he or she, or even us at Shape Clinic, be more than happy for you guys to come in, to have a look at what we do on a daily basis, to basically, making sure that this is what you want to do.
Yeah, absolutely. Yeah, I think a lot of the times what we learn in university is very different from kind of the bread and butter of a practice.
Correct.
Yeah.
Correct. It's absolutely. So I say the sky is the limit. You just have to decide whether you want to do something. Don't do something because everyone's doing it. Do something because you like it. Unless you like it, you'll never be good at it. If you're never going to be good at it, you'll never be great at it. It's going to show through the quality of your work.
Yeah, absolutely. That's great advice for sure. Do you have any other kind of general advice for our students here and for our students? Any other questions for Dr. Liew?
Come on, guys, I've been talking the whole night. My advice to you guys is go and enjoy your life.
I've got sorry, Jeffrey Tai, who's got a career related question. Jeffrey, if you want to ask away.
Yeah, thank you. Can you guys hear me? Hello?
Yeah.
Hi, Dr. Liew. I'm Jeffrey. I'm from Malaysia. I'm a fifth-year medical student from UNSW. And I just did my plastics rotation in Prince of Wales, and I really enjoyed my time there. I just have a question, a bit of a negative question. So I hear some horror stories where the unaccredited registrar can go unaccredited for 8 or 9 years in a row and keep trying, and they just don't get onto the program, and their CV is maxed out. They do well in the interview. They're just, I don't know, they're just unlucky. But it sounds very discouraging, especially when I heard recently that they introduced this 3 tries where you can only try for the college for 3 times and you're out. So my question is, what advice would you give if at a certain point we all reach this stage when we are unaccredited registrars and we keep trying and we just don't get it?
Okay, so Jeffrey, I don't think you should be discouraged by that yet, because hopefully you're not one of those. Okay, so that's, remember I said to you before, it's a supply and demand. In 20 years ago, there's only 2 positions per year. Now, sometimes there are 10 positions a year. Okay, so if you have 100 good candidates and there's only 10 positions a year, that 90 people is going to miss out. Okay, so what is, it's always going to be someone miss out, someone don't get it. So what is the situation? Well, the situation is that maybe you should consider, well, if I cannot be a surgeon, and if what I like is a, let's say you like to be just do a pure reconstructive work, let's say that, then you can say, well, listen, I can be a breast surgeon and I learn how to focus on reconstructive breast. Then you can still do that part of that surgery which you like. It means that you limit yourself to that area. There's nothing wrong with that. Or you can say, I want to specialize in the cosmetic field. Then you might say, well, listen, I'm okay doing cosmetic, but just maybe I would just do non-surgical, because even within non-surgical, there are some minimally invasive procedure you can do within the non-surgical. Okay, so I'm not sure I answered the question for you. That 3 strike is a good thing, because the 3 strike is to stop people having to spend so much time, 10 years waiting to get it done. So that, to me, I mean, I just learned about this last week or so from my training. That is it's a mechanism to be a bit fairer to the individual. I don't think we'll ever solve this problem. It's a problem that occurs everywhere in the world, in the States, you know, those sort of things, when there is a demand for it. It's a supply and demand thing.
Okay, I understand.
Okay.
Thank you.
So what do you want to make sure is you're not the person who will be the 9 years.
Or have a backup. That's is that from my understanding.
Have a backup. Yeah, always have a backup.
Yeah,
absolutely. And like you said, I do think, like, I've also heard of the 3 strikes, and I think more and more specialties are introducing that, like, less as a limiting factor, but more as a actually protecting the junior doctors from kind of burnout as they get through years and years of unaccredited training. And actually after 3 tries, I guess a lot of the times the chances of getting on actually diminish over time, but no one tells you that you probably won't get on. So then that ends up in a situation.
Correct.
Yeah, with people kind of being unaccredited for many years. Whereas I think a lot of the times it's hard for juniors to kind of take a step back and assess the other options, because we're so kind of, this must be the one option.
You got your blinkers on.
Yeah.
Then it's something that you say, you got to think at that certain stage in life. Sometimes I believe what will be will be. There's a reason things happen. It may not be, you might apply for this job, you didn't get it. It doesn't mean that, you could be suck at it. Okay. You could be hopeless at it, or you're not hopeless. There's something a lot better than you've got it. Right? Think about it. In the Olympics, if you make it to the Olympians, it's not because they're bad. It's just they're one person on that day who was so much better than everybody else. That's why they got the gold medal. So you got to think that way. Otherwise, life will just become meaningless. Right?
Yeah.
Because you didn't make in doesn't mean that you are not good at it. It's just that the timing is wrong for you. And maybe you're not meant to get it. Okay? For me, I'm not meant to be a professional fashion photographer.
So will you consider kind of coming back full circle and becoming a professional photographer at some stage?
No. I mean, what I like now is to more of thinking of how to package education and using technology to deliver it visually, to deliver it so that it's a much better storytelling. That's what I feel that I'm more sort of attracted to, right? Because to find out what the audience want, what will click to the audience, what sort of platform, and how do I deliver this education, whether it's a piecemeal or whether in a slightly different way, to engage them, and in doing so for them to be interested.
Yeah, absolutely. And I do think that education, like you said, edutainment really is the way to go with our ever shortening attention spans, and all the multimedia that's available to us as well. And
correct.
And the future of distance education with Zoom and all these things as well.
Yeah. I mean, everyone Zoom out, right? Everyone is Zoom out. You got to create something a little bit different, even in the virtual world, to get people sort of like, okay, something different. Yeah,
absolutely. All right. Well, if there's are there any other questions from the floor? Our last call for questions. And
hi, Dr. Liew. Yeah.
Hello.
Hi, I'm Vivian. Thank you so much for sharing your amazing story, led to your success, and you gave a lot of great recommendations to our med students and junior doctors. Actually, I attended your Sunday's webinar on the lower face show, which was a huge success, I think. As far as I can remember, you invited more than 20 local and international doctors to show their techniques. And I'm wondering when your next session is.
Okay, now, if I tell you, I will have to kill you. I think all I can say is we are planning to hold one in the second half of this year, maybe September, October. We are planning for a true aesthetic show in front of a live audience. So we will think of going to in New York, this is Saturday Night Live, okay, SNL. Think of going to a Saturday Night Live show where you see the people performing live, but you're sitting there as an audience, and that will be also broadcast at the same stage. There's a lot of, so the audience become participant within the show. That's what we aim for, and we're aiming to also host a face-to-face live cadaver workshop.
That sounds great. Yeah.
So it will be sometime in, I think, September. The hardest thing for us is because of COVID, it's still a little bit unpredictable and disruptive. So rather than holding a 500 to 600 live audience, which we had in our first meeting, we have 495.
Wow.
We might just have a 200 or 150 audience. Now the problem is, I know that 150 ticket will go just like that. So it's almost like trying to be fair. Who do I give it to? And so I'm still in the process of thinking so that not everyone will be disappointed.
Yes, certainly. I'm looking forward, to receiving all those information. You just mentioned that, like for junior doctors who are interested into the plastic surgery training, they can actually get onto that society you mentioned. How they can access to that?
I think this is Lucy. How do they?
Oh,
You mean our
your
society at AMSC? Yeah.
Yes. So I'll send you guys all a link in the chat box, but we have like a sign up for students. So you can keep in touch with us for our future sessions, as well as, when we open it up to finding mentors and finding people to contact for, things like those clinic placements, or things like, more questions for advice. Because as you progress through the years, you probably will have different questions as well. So I will pop a link to the chat box right now, and I will encourage you all to sign up. Great. Here we go. So you should be able to see that in the chat. So I guess if there's no more questions for now, we might just tie things up because of time. So I guess once again, thank you so much, Dr. Liew, for sharing your story, giving us more insight into a career in plastics, as well as how kind of, the different things you can do as part of your role, like in education and in doing all these non-conventional things. And thank you for all the advice you've given as well. And I just wanted to thank you on behalf of all the students and AMSC as well for sharing your time and your story. Certainly very
No problem. It's a pleasure. All right, guys. Have a wonderful night. Enjoy.
Thank you both.
Thank
Bye-bye.
you. All right. I'll just end the meeting for everyone then.